Colorado is changing the rules for vaccines again. The shift from the governor today blindsided public health providers who suddenly got a wave of people 70 plus who had been told by the governor that they were immediately eligible to get a vaccine. There's not currently a plan for that. Democratic Governor Polis announced that the state was moving on to Phase 1B before it finished 1A and moving up people 70 plus along with a slew of essential workers. And those vaccinations can start now. Our Steve Steger talked with public health leaders scrambling today to catch up with the governor's announcement.
Today, we are updating and entering in many parts of our state Phase 1B.
Phase 1B looks a lot different than it did just weeks ago.
Any Coloradan 70 and up can now legally receive the vaccine.
Coloradans over the age of 70 now join non-frontline healthcare workers and first responders in this adapted second phase of the vaccine rollout in Colorado. Along with them, essential workers moved up. Teachers, grocery store workers, bus drivers, and train operators, to name a few. Even government leaders and some frontline journalists.
Starting today, many areas of the state are moving to 1B.
It's an announcement that caught local public health leaders, the ones in charge of figuring out how to get the vaccine out, completely off guard. Phones began ringing nearly nonstop at health agencies and doctors' offices. Someone even showed up at the Pueblo County Health Department to try to get the vaccine.
I think we really do have to work on logistics about how to get the vaccine to individuals over the age of 70.
Dr. Anuj Mehta with Denver Health has advised CDPHE on vaccine guidance, but even he didn't know this was coming.
As information becomes available, they're going to start communicating it in terms of where you can get the vaccine.
Many are questioning how the state is ready to move to 1B when a lot of 1A people living and working in long-term care facilities are still waiting on their turn. The first clinics for those facilities started just 2 days ago.
There's just a lot of confusion and a lot of wondering and frustration that they're seeing folks in 1B now getting access to that vaccine before they do.
Lafayette Mayor Jamie Harkins has been trying to get information for long-term care facilities in her city, some of which don't have a date for their vaccine clinic yet. The state says the vaccines have been allocated. It's just a matter of getting the dates scheduled with pharmacies.
They were given a lot of hope in that 1A group, so I'm just really anxious for those vaccines to get out to them.
The public health departments I talked to in the metro area today say they are not done with 1A yet. Very hard to tell where they are just because they have to talk to so many different people involved in that process. Now, all of them are saying now that they're working pretty hard to try to figure out how to implement these new changes and get these vaccines to people 70 and over. They might do it through mass vaccination sites where people almost can drive up and you get a shot. They might partner with local agencies within their jurisdiction. It's going to be different in all cases. And as we heard the doctor say there, the best thing you can do instead of calling is just to try to keep an eye out on your local health department's website of how you might be able to get this.
Just brutally frustrating for people, Steve. We've been asked all day long, where can I get my vaccine? Governor told me I can get a vaccine. And I've heard as well, guessing you have too, from people who are tied to some of these long-term care facilities who are furious that their residents, isolated, alone, on lockdown because they are the most at risk, are about to see on television as a bunch of other people get the vaccine before they do because they've been scheduled out weeks from now.
Yeah, it's disheartening for those people who've essentially been locked in their bedrooms for 9 months waiting for something like this. They see that light and they're offered this opportunity and they don't get a chance to get it right away. What I'm being told in a lot of cases is this has to do with the federal contracts with the pharmacies who are in charge of getting this vaccine out to these different facilities, that all of that vaccine has almost been allotted. And now they're just trying to get these clinics scheduled so that they can get folks and workers vaccinated inside those facilities.
Well, as the next week or two goes along, if people in Phase 1A, these long-term care facilities, are not getting the vaccines that they were promised in order, I encourage people to continue making noise. Steve and I are both listening. We'll try to elevate those concerns. Steve, thank you.